Hi, I'm Dr. Blink, and we're starting a new series on threads. Threads is something I'm very passionate about. And what are threads? Threads are dissolvable sutures, like the stitching material, but we put it just beneath the skin, and it's more to give a nice power lift. So it's about lift, repositioning sagging tissue, as well as collagen boosting. We can also do a bit of facial contouring with the threads as well. The threads that I love using are the Aptos threads, because I know that they're well clinically researched. They're designed by plastic surgeons, and when you're putting something in your face that's going to be there for 18 to 24 months, you've got to make certain that it's a high quality product. You don't want to get any complications, side effects. So very important, the right product. Do threads replace biostimulators? And the answer is definitely not. The two products work very well together. Biostimulators is about collagen stimulation as well as skin tightening, whereas the threads is more about repositioning sagging tissue, contouring, as well as giving that power lift. The Aptos threads that I use are coated with hyaluronic acid, and that the hyaluronic acid also just boosts the collagen. The nice thing is that it remains there in the skin, improving skin quality at the same time as giving you that lift. Thread lift will not replace plastic surgery. Both have got advantages and disadvantages. The nice thing about threads, there's minimum downtime, there's no hospitalization, there's no scarring, and there's no cutting or blades involved at all. The important thing with threads is choosing the right patient and making certain that you are the right patient. So one of the things that I look at is the skin quality. Your skin must definitely not be too thin, and your skin needs to be healthy as well. At the same time, you mustn't have a lot of fatty tissue or heavy jowls, or to have too mature, advanced skin as well. Sometimes we get to the point where we need plastic surgery rather than just a medical aesthetic treatment like threads. But the great thing about threads is it is regarded as minimally invasive, and it's regarded as a medical aesthetic treatment and not a surgical treatment. A lot of my patients come to me, they say they don't want surgery. What can you do? What is the best result that you can give me without having to cut? And threads might be a great option for you. So part of the threads procedure is you need to just come and have a chat with me. We'll do a consultation, make certain that you are the right patient, making certain that your skin quality is correct, making certain you don't have too heavy jowls, and then I take you through the whole procedure just to put you at ease. We discuss things like your before care, what you should do beforehand to make certain you get your maximum result, things like making certain you don't take any blood thinners, vitamin E, omega tablets, aspirin, anything like that that's going to thin your blood. Then also we discuss your aftercare, how long the recovery period is going to take, what to expect, potential complications. We've got to discuss all of those things. Thankfully, threads have got minimal complications, but like with any medical aesthetic procedure, you can expect there might be bruising, there might be swelling, there might also be something called puckering. Remember, when I'm lifting the skin's got to go somewhere. So there might, if you've got a lot of loose skin, you might have pleats, what they call puckering, a little bit of pleating of the skin on the side of the face. But the great thing about that is it all resolves. It just takes 1 or 2 weeks, but it also depends on your skin laxity. So the areas that I love treating with threads are mainly the lower face. People that want a nice lift. Often a patient will come to me and they show me they're looking for a bit of a lift. Some give me the 1 finger, others 2, 3, 4 fingers. It depends how much of a lift you want. Threads is great for giving that lift. The other areas we can treat with threads is people that want a bit of a tightening of the neck. We can put some threads in the neck, or contouring of the jawline. We can do that with threads, or even if you want a bit of an eyebrow lift. If those eyelids are becoming a little bit saggy, we can do a bit of a lift with threads as well. Others, it's about fashion, about trends, and if you want that nice foxy brow lift, that lift of the outer part of the eyebrows, you can do that with threads as well. The great thing, it looks all natural. You're not going to look like you're out of a science fiction movie. It's all natural, subtle, beautiful rejuvenation, regeneration, and anti-aging. Another thing patients often ask me is, are threads painful? Threads are uncomfortable, but we have all sorts of measures which we put in place to make it as comfortable as possible. We have a wonderful supportive team here for you. Also, we use local anesthetic to inject the points where I insert the threads. And for those patients who are really anxious about it, I can even give a bit of sedative that you're just all nice and relaxed while I do the procedure. How long will your threads last? Your threads, it depends on the type of threads that we're using. PDO threads generally will last you on average like a year, depending on the type of thread, a year. Some of them even longer, a year to 2 years. With the Aptos threads, they're going to last about 18 to 24 months. There is a difference in the type of thread that you're using. What I love about the Aptos threads is they're designed by plastic surgeons and they are well clinically researched products. The threads differ in the type of structure, the amount of lift, the longevity. Some have got cones, some have got barbs. But important, if you're inserting something in your face, make certain that it's a high quality product.